Hello, welcome to VMC. I'm Dr. M. Stay tuned to this video in order to find out how we should best be identifying, treating, and preventing hygromas from developing on our pets. Join me, you'll learn something today. So what are hygromas? Well, they are a fluid-filled sac that develops over bony prominences or pressure points, more commonly on larger dogs, but possible on any dog or cat. In young dogs, the pathogenesis is believed to be trauma, meaning they slam the bony prominence onto a hard surface. In older dogs, we more commonly see this in dogs that don't have their pain adequately treated or who don't have access to appropriate bedding, and so the hygroma develops because they're spending more time laying down as they're too painful to be doing other things. Repeated trauma from laying down on hard surfaces will cause an inflammatory response in the tissue that is over the bony prominence or the pressure point. The body then tries to protect this inflamed area by creating a bit of a pillow there and filling that area with some fluid. The longer that the trauma occurs over, the larger this hygroma will end up growing. The result that you get is a dense walled fluid-filled mass. These are most commonly seen over parts of the elbow, but they can be seen over any bony prominence or any pressure point. If the hygroma is not addressed properly and the body is experiencing long-lasting and more severe inflammation, then you can get secondary complications to the hygroma. You might get infections or tissue erosions, those sorts of things developing instead of just the hygroma being present. You do need to see your veterinarian in order to diagnose a hygroma. Often we can do this with a combination of the history and questions that we will ask and palpation of the mass along with its location. Sometimes we will take a fine needle aspirate of the mass in order to check that it isn't a different type of tumor that just happened to grow in that location. As far as treatment goes, the earlier the hygroma is diagnosed, the better. When they are small and uncomplicated, generally all we need to do is correct the housing and the surfaces that the dog ends up resting on. This might mean offering a lot more memory foam type bedding. Sometimes when it's hot, the dogs won't want to lay on those sorts of beds, so we might just end up needing to put down mats and yoga mats, gym mats, anything that makes the surface a bit more squishy and forgiving while the dog is laying on it. When the dog lays on softer, more pliant material, generally over a time period of 3 or 4 weeks, the hygroma will go away on its own. For these small and uncomplicated hygromas, it's generally not recommended to try to fully drain them. This is because anytime we poke into a mass, we do risk that mass becoming infected, and often in these situations the hygroma will resolve on its own if we just fix the housing. And for the rest of that dog's life, soft bedding and padding will be absolutely imperative. There are some dogs that really seem to refuse to want to lie on that sort of bedding, so we can also consider commercial elbow pads. There are things like dog legs that are now available, and I know that Etsy also has a number of different options available. They do need to be fit fairly well to the dogs so that they provide the right amount of padding in the right location and that they're not causing more problems. Of course, we also need to keep any coverings very clean that the dog might be using. In general, we do want to avoid going at a hygroma with a surgical approach. This is because they have a tendency not to want to heal very well. The reason the hygroma formed in the first place was because the tissue was inflamed and was unable to get a chance to heal. Additionally, the elbow elbow joint comes with an awful lot of movement, and that movement makes it hard for any incisions to heal very well. If we have a hygroma that is infected or that has broken open on its own, then of course we will need to address it surgically. We can use things like positive pressure drains. We can also use things like splints in order to prevent the elbow from moving as much during the initial healing period. Sometimes we need to use skin flaps in order to reconstruct the skin where the callus formed. If the hygroma becomes infected, of course, we also need to treat that with antibiotics. We do have research that putting a steroid into the hygroma is not appropriate and absolutely must not be done. This has a likelihood of causing lesions and ulcers to form, and it does not help the hygroma to heal. As you know, if you've followed VMC for a while, I am all about prevention. I would far rather that you prevent your animal from ever developing a need for any veterinary care in the first place. So as far as preventing hygromas goes, there are a couple of things that we need to focus on. One, we need to prevent our animals from being overweight or obese, as that extra weight puts extra pressure on those pressure points and it makes the formation of a hygroma more likely. Second, we do really need to address that they have proper bedding to lay on, and that does mean soft resting places where the foam is thick enough that when they're laying on it, they aren't contacting the hard floor underneath. Too often I will see beds that are not firm enough or that are not thick enough, and so when a dog lays on it, especially a larger dog, they still are having pressure points where they're hitting the floor through their bed. Memory foam or those egg-shaped foams are often your best choices here to be considering, and you need to make sure that there are plenty of these beds around so that no matter where you are and where your dog wants to be, they have a soft place to rest. When it's hot, or if you know that your dog also sometimes likes to lay on the floor, make sure that you have padding in those areas as well. And lastly, we need to make sure that we are properly addressing any pain that our animals might be feeling. When we properly address their pain, they will be more likely to do the natural shifting and moving around as they're resting, which helps to prevent those hygromas from forming, and they will also be able to move around and do the activities that they want to do and would usually do. That means that they're spending less time laying in one spot, which will lessen the likelihood of them getting a hygroma. Now, I have had a couple of patients that their people are doing everything right and the animal still tends to develop a hygroma. It does happen sometimes, so don't beat yourself up if that's the case. Just do what you can to prevent it from getting any worse. And in those cases, often we can stabilize the hygroma still in a small state, and then the dog just ends up having a small hygroma. If you have any questions, don't hesitate to leave them in the comments section for me. I love to hear from you, and I do read every single comment that you leave for me. I hope that you have the most wonderful week, and I will see you next Friday. Bye! The earlier the hygroma is diagnosed, the better.